Welcome to a presentation of Hive80.com, your #1 online community for health, wellness, and medicine. Thanks for joining us for this informational section on insurance. What is Medicare? Medicare is the federal health insurance program for people who are 65 or older, certain younger people with disabilities, and for people with end-stage renal disease, which is permanent kidney failure that requires dialysis or a transplant. This is sometimes called ESRD. When are you able to obtain Medicare coverage? When you do, you have two choices. The first choice is Original Medicare. So think of this as a PPO type insurance, where you can see any physician that will accept Medicare patients. The second choice is a Medicare Advantage plan. Often, though, this type of plan has a narrower network of physicians that you can see. You'll also likely need a referral from your primary care physician to see a specialist. All right, so let's tackle some of Original Medicare. Original Medicare includes Medicare Part A, which is your hospital insurance, and Part B, which is your medical insurance. If you want drug coverage, you can join a separate Medicare drug plan. A Medicare drug plan is known as Part D. You can use any doctor or hospital that takes Medicare, anywhere in the U.S. Supplemental coverage, like insurance from a former employer, or Medicare supplemental insurance, often referred to as Medigap, to help pay your out-of-pocket costs, like your 20% coinsurance. All right, let's go over Medicare Advantage, also known as Part C. Medicare Advantage is an all-in-one alternative to Original Medicare. These bundled plans include Part A, Part B, and usually Part D. Plans may have lower out-of-pocket costs than Original Medicare. In many cases, you'll need to use doctors who are in the plan's network. One big difference in Medicare Advantage plans is that most plans offer extra benefits that Original Medicare doesn't cover. This often includes things like vision, hearing, dental, and more. All right, Medicare Part A, what is covered? If you're in a Medicare Advantage plan or other Medicare plan, your plan may have different rules, but your plan must give you at least the same coverage as Original Medicare. Some services may only be covered in certain settings or for patients with certain conditions. But in general, Part A covers inpatient care in a hospital, a skilled nursing facility, or home health care. Medicare Part B. So what's covered there? Note, if you're in a Medicare Advantage plan or other plan, your plan may have different rules, but it must give you at least the same coverage as Original Medicare. Some services may only be covered in certain settings or for patients with certain conditions. Part B covers two types of services. Medically necessary services. Services or supplies that are needed to diagnose or treat your medical condition and that meet accepted standards of medical practice. Preventive services too. Healthcare to prevent illness, like the flu, or detect at an early stage what treatment is most likely to work best for you. You pay nothing for most preventive services if you get the services from a healthcare provider who, 1, accepts assignment, like Part B, and covers things like clinical research trials, ambulance services, durable medical equipment, also known as DME, mental health, inpatient services, outpatient care, partial hospitalization, limited outpatient prescription drugs. Medicare coverage is based on three main factors, and this is important. It is based on federal and state laws, national coverage decisions made by Medicare about whether something is covered, local coverage decisions made by companies in each state that process claims for Medicare. These companies decide whether something is medically necessary and should be covered in their area. For more access to this important information, visit the Hivecast at hive80.com. Thanks for listening.